Next speaker is Dr. Kristie Ebi. She is a professor in the Center for Health and Global Environment at the University of Washington, has been conducting research and practice on the health risks of climate variability and change for 25 years. She will be speaking on managing the health risks of a changing climate.
Well, I really appreciate the opportunity to talk with you, really appreciate the invitation. Really appreciate all of you sitting in an overly cold room for a couple of hours. I stand between you questions and the coffee break, so I'm going to move around a little bit to try and keep everybody awake, and hopefully can move through this quite quickly. It was a challenge looking at all the great speakers to figure out what to talk about that wasn't going to cover what other people talked about, and so far I think I've done pretty well. I was surprised that nobody showed this. How many of you have seen this figure? A few of you have. This is one of the figures in the Intergovernmental Panel on Climate Change synthesis report that just came out a few weeks ago. It is in one way very similar to all of the figures that come out in the synthesis report, in that it shows you what happens with global mean surface temperature under a range of scenarios. It shows it a little differently than what's been done before. But this has been extensively downloaded, more downloaded than earlier figures. And I think, of course, it's because people are in the figure. And so this figure is pretty much everywhere. The other thing I wanted to ask, how many of you have some training in epidemiology? So several of you have. One of the other things that really struck me about it is it's not just that people are in the figure, but as epidemiologists, we spend time thinking about cohorts. That people born during different time periods have different experiences. And so it's not just your zip code that determines your mortality in the US. It's also the time period in which you were born. There's lots of studies, for example, of people born when TB was prevalent, and how they had different kinds of health outcomes than people after we brought TB under control in the United States. This very clearly shows cohort effects. And what it's going to mean, we're talking today about children, but what it's going to mean going forward, because very, very different exposures will occur over time. And so all the presentations talked about different kinds of risks we're facing with a changing environment, but we also need to think about when people were born. And that will determine much of their exposure. And I'm not going to go into that in a lot of detail, but it is something where I think a lot more work needs to be done because there hasn't been a lot of thought put into these kinds of cohort effects. And I've got two different, which one of these is going to make it go forward? That one? Nope. That one? Look at that. I'm supposed to talk about managing health risks, and so I'm going to put this in the context of climate resilient development. And as we go forward, we need to think about not just our changing climate, but our changing environment. We heard a little bit about that. I'll talk about it more. When we think about the basic strategies in terms of addressing these changes, there's reducing greenhouse gas emissions, reducing biodiversity loss. In terms of our health systems, it's how we're going to be modifying our health systems. What kinds of changes need to be made to make sure our health systems are prepared? And then as we frame it in health, the quote unquote upstream drivers, we need to think about what's happening with development. What kinds of choices are being made in our development pathways? And what does that mean? And how can we as health professionals help promote this climate resilient development? Specifically about adaptation, there's a very, very long list of effective adaptation options. When we think about the health risks of a changing climate, all of them are current problems somewhere. And we need to take advantage of the 150 years in public health on trying to manage various health outcomes. However, we're entering into a phase of high uncertainty. We're entering in a phase of high change. None of our policies and programs were developed taking climate change explicitly into account. we do not know that they're fit for purpose. We do know that there's a lot of work that has to be done. Starting with strengthening the resilience of our health systems, which nowadays is a very easy story for me to tell because all I have to do is say COVID. And everyone understands that we're not at a place that's fit for purpose to be able to manage the kinds of risks we're facing. I suspect very few of you follow this, but every month NOAA puts out seasonal forecasts. And this is a seasonal forecast that came out a few days ago for the summer for the US. And you can see the color schemes. I'm going to now talk about heat for a few minutes. These are worth public health professionals knowing about. Because as you think about the work that you're going to be doing with children, the work you do in the hospital and the emergency departments, it's going to be hot. We know what happened during the last heat waves. We know that many places are not prepared and need to think about then the message that we give. We know, for example, from quite a long list of studies that pregnant women are at higher risk when they're exposed to high temperatures in the last trimester of having a low birth weight baby. There's some evidence of having increased in the number of stillbirths. But messaging to pregnant women to understand that they're at higher risk is critically important. Also messaging, a really unfortunate statistic in the United States is there's dozens of infants that die every year because they're left in an automobile unattended. Parents with the best of intention drive to the store to buy some milk, baby's asleep, leave the baby in the car, not understanding how fast a car heats up, and that babies physiologically can't manage that. And they come back and the baby's died. That doesn't have to happen. So finding ways to get that messaging across. A key approach is developing heat wave early warning and response systems. And I'm going to emphasize and response. It's not just knowing it's hot. People generally know that it's hot outside. It's not really new information. But what do you do about it is critically important. And that's where a lot more effort needs to be put into. For those of you who've got training in public health, you'll recognize these are the 3 standard approaches we have in public health. You reduce the exposure. If you can't reduce the exposure, you try to prevent the onset of illness. If there is illness, then you do what you can to make sure people have access to care. And so all of these are critically important. I was talking the other day, one of my colleagues works half-time in the emergency department and asked, we're writing something that somebody wants us to start with a story. And so I said to him, do you have a story from the heat dome that hit the Pacific Northwest? And he said, walking into the emergency department, seeing somebody's feet sticking out that were completely burned, 3rd-degree burns on the bottom of the feet from walking barefoot on asphalt that had become so hot because the temperatures were over 100 degrees. We don't need to have these things happen. Essentially, all of the risks around heat are preventable. And so making sure we've got that messaging is important. Many places now have heat wave action plans. The one for the UK is particularly good. There's lots of examples to look at. They're not difficult. They require a lot of coordination, requiring thinking about all of the people who should be at the table. We heard about redlining. Who's the trusted voices for the red line district? Who's the trusted voices for the people who take care of the unhoused? And making sure that all of those people are part of the solution, to make sure that when you do have messaging, it goes out. It goes out to tourists who don't understand English. It goes out to a whole range of people and make sure that we can provide the best messaging possible so people are motivated to take action. Action does not need to include air conditioning. These are quite nice infographics that were put together for some papers on heat and health that came out 2 years ago in The Lancet. The Lancet put these together. I'm very happy to say that these are translated into Spanish and into Hindi, trying to get them translated into French. They're freely available. But it shows lots of ways that people can cool down without having access to air conditioning. One of the things that was not mentioned about the red line districts is not only are they hotter than the surrounding area, but often they're food deserts. So people don't have access to quality food. That means that many people who live in red line districts have higher rates of chronic diseases. They're at much higher risk baseline for a heat wave, and then the temperatures are much hotter. So finding ways that they know what actions that they can take to help protect themselves. The second part of the slide is we need to think about not just today, but in a very different future. And so most places now are starting to think about heat action plans of how do we prepare for a very different future. And there's lots of ways that we can do so. Planting trees in the short term will make a difference in the long term, as long as we're paying attention to what trees we're planting. We don't want to exacerbate allergies. And we want to make sure those trees are going to survive in a much warmer and drier climate, particularly here in California. And so it's not a simple solution. It's certainly something that can be done. And there's people like Chris Field, who's going to talk later today, who's got a group that's looked at those kinds of questions. This is a recent example from Europe, looking at how many deaths could be avoided from high temperatures by making sure that European cities have at least 30% tree coverage. Real nice piece of work. A lot more needs to be done in that space, but showing that we've got multiple solutions at hand. And mostly want to focus on heat as an all of society problem. We're focused on children, we're focused on health, but we need to think about all of society. I live in the Pacific Northwest, the Pacific Heat Dome, about 800 excess deaths. These are about 800 people who died during the heat wave who would not have died otherwise. And as an aside, there's a field in climate change called detection and attribution. It does exactly what the name implies, detects whether there's been a change in a trend, and then attributes some proportion of that change to climate change. The Pacific Heat Dome was virtually impossible without climate change. That means those 800 some people who died because of climate change. That as someone who's worked in this field for quite a while, we're in a new era. This is not talking about associations. This is not talking about risks. This is saying people are dying from climate change. And that's a very powerful message to get out. And we need to get out the companion methods of heat as an all of society problem. So in the Pacific Northwest and the heat dome, the area between south of Seattle and Vancouver, BC, is the Salish Sea. There's a lot of oyster beds, mussels and clams that are food security for coastal tribes, for example. They're part of our economy. The temperatures were so hot at low tide, about 1 million mussels, clams, and oysters were literally cooked. And you think about the consequences for children. You think about the consequences of affecting food security. And so thinking more broadly about what needs to be done and how to move forward in this space. I'm glad that somebody mentioned wildfires. All of us on the West, you think heat, you think wildfires. The point that wasn't made, these are data from the Lancet Countdown, is how much exposure is increasing. And so we're seeing more exposure. I think it's really important. We heard several times this morning that the PM from wildfire smoke is more toxic than the PM that comes out of your tailpipe. And making it more clear that this is a different kind of health risk. It's another place where there's a lot that needs to be done in terms of research, because we're seeing very, very, very high exposures over a couple-week period. And this is different than the kinds of studies that have been done on air pollution, because they're more chronic exposures, children living along highways, for example, or heavily trafficked roads. But what does it mean? There was a community outside of Los Angeles last summer that had exposure to particulate matter of over 700 parts per million. It's huge exposures. And what does that mean for developing lungs as those particles come into the lung, cross the barrier, and go into the bloodstream? And better understanding of those is really important. Somebody mentioned allergies and asthma. We had a very, very nice presentation on that. I usually ask people, how many of you have allergies or asthma? It's usually about a third. And sadly, welcome to the future, there's going to be a lot more. The other point that I didn't hear quite clearly, maybe I just didn't hear it in the presentation, was the impact of carbon dioxide itself. Carbon dioxide is affecting our plants in ways that are altering their internal composition, shall we say. That when we look at the plant kingdom, all plants have a way to bring in carbon dioxide from the atmosphere and use the photosynthetic pathway to break it apart. Use the carbon to grow, and then, happily for us, emit the oxygen. 85% of our plants have one particular mechanism that's used. They're called C3 plants because of the photosynthetic pathway. And for C3 plants, with higher carbon dioxide, we see more carbohydrates, we see more carbon-based molecules, fewer nitrogen-based molecules. And so we see more pollen because it's a carbon-based molecule. I'm not going to go into nutrition, but nutrition is critically important. The nutrient density of our food is declining for wheat, rice, barley, potatoes. Protein's going down, B vitamins are going down, and micronutrients are going down. So there's big consequences for human health and well-being from carbon dioxide itself. I was very glad to hear about health co-benefits. It's a huge issue that is not being well articulated, certainly in the health community, but it's not getting out to the policymakers. I spoke to policymakers from Europe at the Conference of the Parties for the last meeting in Sharm el-Sheikh in Egypt, and they just hadn't heard about the health co-benefits. This is a summary slide put together by Catherine Bowen in Australia. And it just makes the point that when you start looking at ways that we can reduce greenhouse gas emissions, almost all of those have benefits for our health. You can quantify the avoided hospitalizations, quantify the avoided premature deaths. Economists like to value those. You can count up all the benefits. And overall, the health benefits of mitigation are the same order of magnitude, if not larger, than the cost of mitigation. We should be mitigating for our health. Got 2 minutes left, and I've just got a couple of slides. I wanted to move on to somewhat a broader frame. This paper was published on the 31st of May from a group called the Earth Commission, led by Johan Rockstrom, and looking at identifying not just thresholds and tipping points, you heard about that, but thinking about going into a more sustainable future. How can we identify boundaries that are safe for the planet and just for people? So taking both just and safe into account. This looked at 6 Earth system boundaries. We can talk about this later. It's in Nature. It's freely available. I knew we'd have lots on air pollution, but thank you, John, for not showing this particular figure. This is one that just came out, and it's a message we understand well in health. I think it's very nice to see it mapped. It shows you concentrations of mean PM 2.5 by levels of poverty. We know this, but we're not communicating as clearly as we could with these kinds of figures. And of course, like everyone else, I've talked about all of these issues separately, but they all cascade. I really like this figure that Luke Kemp put together on certainly my right-hand side, showing you various kinds of interactions. In this case, focusing on food, fuel, and water shortages, but you could do something similar for just about everything else. And so thinking about all of these interactions. And then to go back to my first point of thinking about cohort effects, on the left is a study that just came out from Tim Lenton. It basically says, as we keep talking about a warmer future, but the figures on the left just show you how much warmer it's going to be. and thinking about what that means in different places around the world. And Tim, in specific, looked at sort of envelopes of where humans have traditionally lived, the temperatures in which we've usually lived, and show how we're moving outside of these traditional envelopes. With that, thank you for listening. I am actually going to, I'm only over by 20 seconds.
That's fine.